Hello, my name is Finton. I work in healthcare. I believe in letting nature take care of us, especially when it comes to our health. So in this short video, I'm going to talk about a natural remedy for blocked fallopian tubes. There is a natural treatment for blocked fallopian tubes that I'd like to tell you about. So many women find it almost impossible to have a baby because of blockages in their fallopian tubes. Surgery doesn't have to be the only way to unblock those tubes. Many women have reported serrapeptase, the enzyme, to be an effective natural treatment for blocked fallopian tubes. So in this video, I'm going to give you all the information on the causes of blocked fallopian tubes, what are the symptoms, what you can do to help with the pain. I'm also going to talk about ovarian cysts, causes, symptoms and treatments. Blocked fallopian tubes are a common cause of infertility in females. The tubes need to be fully open to allow the sperm and the ovum to meet. If the tubes are blocked, it's impossible in most cases to become pregnant. And there may be several causes that cause scar tissue to form a blockage, ranging from pelvic adhesions, endometriosis, inflammatory bowel disease, or an infection. What are the symptoms? Well, in most cases, blocked fallopian tubes won't show any symptoms until you try to get pregnant. However, in a few cases, blocked tubes can cause mild pain, sometimes on one side of the abdomen. This type of blockage is called a hydrosalpinx. It happens when the fallopian tubes become blocked because of excess fluid. What is PCOS, or polycystic ovary syndrome? It's a condition that occurs in women during childbearing years, normally 15 to 44. According to a trusted source, a good number of women in the population have PCOS, anywhere between 2 to 26.7%. Primarily, it affects the ovaries. These reproductive organs produce progesterone and estrogen, the hormones that regulate the menstrual cycle. Ovaries will produce androgens, which are male hormones as well. During ovulation each month, the ovaries will release eggs that can be fertilized by the male sperm. Ovulation is controlled by the hormones FSH and LH. FSH acts to stimulate the ovary to make a follicle or sac that holds an egg. Once the egg matures, the LH assists the ovary to release the egg. PCOS is called a syndrome because women with the condition have infrequent or prolonged ovulation processes or excessive androgen, which is the male hormone. PCOS is a syndrome or symptoms that happen together and affects the female ovaries, and the three main symptoms are ovarian cysts, excessive levels of androgen, the male hormone, skipped or irregular periods. During polycystic ovary syndrome, a lot of tiny sacs filled with fluid grow in the ovaries. Polycystic ovaries means ovaries with small cysts. The small sacs of fluid are called follicles and contain an immature egg that never matures enough to set off ovulation. When ovulation doesn't occur, the levels of estrogen, progesterone and hormones FSH and LH are altered. Levels of estrogen and progesterone are usually lower, whilst levels of androgen are usually higher. The higher levels of the male hormone in women with PCOS mean disruption to the menstrual cycle, causing fewer periods that would normally be the case. Ovarian cysts are tiny fluid-filled sacs that develop inside the ovaries during ovulation. At the time the ovary releases the egg, normally these sacs don't cause any harm as they disappear eventually. Ovarian cysts affect most women during their lifetime. They are small and without symptoms. However, in some cases there may be some symptoms like bloating, swelling, pressure, lower abdomen pain where the cyst is. If your doctor has discovered an ovarian cyst, he may well wait for a period of time to see if the cyst gets any bigger. In some cases, surgery is needed to relieve the pain when the cyst doesn't go away or if you're past the menopause. Pain relief from ovarian cysts and blocked fallopian tubes is possible with this natural treatment for blocked fallopian tubes. Ovarian cysts can sometimes cause bleeding. That needs medical attention immediately. Birth control pills may help in preventing more cysts from occurring. In rare cases, they can become cancerous with an increased risk as you get older. When pain is present from ovarian cysts as well as period pain, the normal course of action is to take non-steroidal medications. However, not every woman gets pain relief from these and may need a stronger medication that contains codeine. Some natural methods that may help with ovarian cyst or scar tissue pain include massage, stretching exercises, hot water bottle, heating pads, relaxation techniques, transcutaneous electronic nerve stimulation, that's a nerve signal for pain, weight loss, changes to diet, or enzyme therapy, serrapeptase, natural treatment for blocked fallopian tubes. Other treatments for ovarian cysts are medical or birth control pills that help to regulate hormones and lessen the risk of more cysts developing, metformin anti-diabetic medication, surgery to remove the cyst, surgery to remove the blocked fallopian tube or the ovary where there is a severe damage to the structure caused by the cysts. During the past 10 years or more, many women have talked about how their blocked fallopian tubes have been unblocked with serrapeptase. It really is amazing that this miracle enzyme can be so safe and effective in removing scars and ovarian cysts. Medical doctors have not yet offered this enzyme as a natural way to remove scar tissue. IVF or surgery are really not necessary anymore for blocked fallopian tubes or ovarian cysts when there is a natural alternative in serrapeptase to dissolve that troublesome scar tissue and allow your body to heal itself naturally. Serrapeptase is a safe, natural alternative that provides a way to dissolve inflammation that causes pain, for example in blocked fallopian tubes. Serrapeptase works to dissolve the dead tissue and safely eliminate it from the body. This action allows the body to heal itself, meaning that the idea of conceiving a baby can become a reality for so many women. Serrapeptase is very safe, side effects are few for most people. It can be taken with other medications. How many serrapeptase should you take? Well, for blocked fallopian tubes or ovarian cysts, it's recommended to take 1 serrapeptase up to 3 times a day for the first 3 weeks to reduce the discomfort, and for a further 3 to 4 weeks to ensure the scar tissue has completely dissolved. What strength should you use? Well, serrapeptase is available in doses ranging from 80,000 IU up to 250,000 IU for scar tissue. The recommended dosage is 80,000 IU to be taken 3 times a day on an empty stomach with water. Your diet is important, so my food plan is available on my website as part of your plan to unblock fallopian tubes by taking serrapeptase. I hope you have enough information on serrapeptase as a natural remedy for blocked fallopian tubes. I believe that if you give serrapeptase time to work, it will unblock your tubes and increase the chances of becoming pregnant. Which serrapeptase should you use? Well, it's recommended that you use the original and best serrapeptase formulated by Good Health Naturally. You can find out more details on my website. Thank you very much for listening. Hello, my name is Fintan.